Hi, Dr. Henry and Minister Dix. So I'm looking at the over 7,000 people who got their shots yesterday, which is great. A lot of them probably first shots. And a lot of those people would be young adults, presumably, since they were kind of left to last in the queue. And so if they're going back to campus this fall, they're not eligible if the interval is still 8 weeks between first and second dose for getting their second dose until the beginning of October now. So how do the campuses, how are they expected to handle having a partially vaccinated student population? And also, when the students do want to get their second shot, do they have to go through the registry? Is that how it's going to work now, and they wait for the call? Or do they just show up?
In the end of August, as people are arriving to go to university, in terms of how people are going to be able to access it, those are things that we've been working on as well with the post-secondary institutions, and especially for the larger ones, we need to have vaccine available at student health services within reach of students' access very easily on campus, and we're working on those as well.
And Mary, did you have a follow-up question?
Yes, just briefly then on shots that have a shortened interval, regardless of what age the person is who gets that, is there more of a concern that a shorter interval shot is ultimately less protective in terms of vaccination than if they've waited what you originally had hoped would be 11 weeks as the ideal?
Yeah, so that was another really great question, that's something I've been consumed with for a number of months, as you probably know. What is the optimal interval? We still don't know that for sure, but there is increasing evidence that having at least 6, 8, 10 weeks between doses, if you're able, probably gives stronger and longer lasting protection. So for the vast majority of people in BC, that interval has been at least 7 weeks or longer. And I think that is one of the reasons why we're seeing such good protection in settings like long-term care. But it is a balancing and a bit of and some would say a race in some ways, between protecting people with 2 doses when there's a lot of virus circulating in the community, and getting that extra bit of cell-mediated protection that you probably get if you extend the interval a bit longer. So it is different for different people in different parts of the province. Right now in the central Okanagan, it's much more important that we get most people with the second dose as soon as possible, because we have a lot of the virus circulating, relatively lot circulating right now. But for most of us in areas where it's not circulating, it's better to wait a little bit longer if you can. So those are all the considerations that we've been working through with our BC Immunization Committee, and we'll have some more information about that as we analyze what's happened this week and as we get closer to the fall.
Oh, hi, Dr. Henry. So faculty and students at SFU has issued a letter today indicating concern about returning to classes without students being required to be vaccinated or masked. And UBC president states he cannot enact either of those without approval from your office. So with Delta variant surging, would you allow universities to bring in their own mask mandates and their own vaccination requirements? Thank you.
So this is another area where we've been working very closely with the post-secondary institutions about making sure we have the measures in place that are appropriate and that are needed in those situations to make sure that we can get back to in-classroom learning for young people. We know how important that is and how challenging it was, particularly for people who were starting their university career last fall. And so, yes, we are working very carefully with them. I did see the letter from SFU, and there are many important points that we are addressing. There are some that we'll need to continue to work with them on, but these are ongoing discussions, and we have the basics in place to make sure that we can have in-classroom learning across post-secondary institutions in BC, and we'll continue to work with them as we head into the fall.
Hi, Dr. Henry and Minister Dix. Just wanted to ask you first off, you did mention that somebody else asked about post-secondary students and staff wanting stronger health measures this fall, but will you support mandatory vaccination rules and masks on campuses if that's what individual administrators at UBC and SFU and other post-secondary institutions say they want to happen?
Yeah, so that's a bit of a rhetorical question, Marcella. We are working with them to find out what are the best, most important things. I think what is critical, and I've said this repeatedly, is that we're not denying people an education because of their immunization status. So there's a whole bunch of factors that need to be taken into account there. One is where people are coming from, making sure there's access to vaccines at the place, at universities, and we're working on those and how that can happen effectively and efficiently. And there needs to be provisions for people who cannot be immunized, even though they may be a small number of people, and provisions for what we're going to do in those settings when we have increased community transmission, which is going to happen in certain communities over this next fall. So all of those things are factors that are being taken into place so that we have adequate plans for all of the post-secondary institutions. And we're working with them on these right now. So it's not a simple question. It is something that we are looking at all of the different factors that need to be accounted for.